Welcome back. Well, today I am joined by Christine Chung and Chuck Lee from 7-Day Dental. And today we're going to talk about gum disease and oral cancer. Well, welcome both of you to the Zoom. How are you?
Good, thank you. Good morning, Lisa. Thank you for having us again.
You're welcome. Well, I haven't had both of you, so this is kind of nice. I know things are kind of busy and crazy with COVID still happening, although we're moving in a better direction these days. So I think that's a good sign that people will start to not feel so scared to come in. Now, I know last time we talked, Christine, we were talking about how you guys are really, cleaning and sanitizing, making sure everything looks good. Now, hold up your mask, because I loved your little mask that you just had, the 7-Day Dental mask. Love that.
Yeah,
that
everywhere
great.
we go, it's the new norms that we wear our mask.
Right, and we can advertise at the same time. That's awesome. Well,
so patients start coming back, and they feel very comfortable, just like what we have done in the past. Amazingly, we have great compliance. When they come in, they do follow directions, guidelines that we have put out according to CDC guidelines. Everybody is practicing social distancing and wearing a mask, hand sanitizer, and we do sanitize each patient they do come in.
Oh, that's good.
Also, we take their temperature.
Yes.
And we're very careful on the day of making an appointment to make sure that we go over the questionnaire, to make sure that they're not sick or having anyone sick in their family. And we do the screening again when they come in.
Okay.
So we're taking very strict precaution to make sure to keep our staff and patients safe.
Yeah, well, your business, you definitely have to, because you're so close to most of your patients.
Yes.
So I think that's a great thing that you're doing. So let's talk about some of the things. I mean, people may have been putting off coming to see you over these last several months. So dental decay, now it is caused by a variety of different things. Can you go over that with us?
Yes. So it's caused from bacterial buildup and during this time, we're eating a lot more multiple times per day, and we're not brushing multiple times per day. So we're getting more buildup. Therefore, we're getting more bacterial buildup. And we know the relationship between heart disease and gum disease and dental decay, that the more bacterial buildup, more plaque buildup, only going to make it worse for the heart and other system in our body. And we really feel that the body works as a whole, and the mouth is just a part of the body. And we want to make sure that we're keeping that patients can come in to at least come in, get a checkup to make sure that nothing's chipped, broken, there's no new decay, and they're able to, and they are flossing well and brushing well. We know that a lot of patients, as we get older, they're going to be taking more medicine, multiple medicine. That one of the side effects is dry mouth. And when that happens, patients are not aware, because it's a very slow effect. So patients don't really feel like they have dry mouth. The only thing they realize is they have to drink more water. But what happens during dry mouth is you're going to get more plaque and food buildup at the gum line. And when you brush or floss, you actually have to spend more time to brush and floss, because when the food is dry, it's just harder to remove.
Right.
And when we're younger, the saliva did all that. It cleaned our teeth. Our kids, I remember when my kids were young, they don't brush for 2 days, and their teeth are still clean, because they're in salivary secretion is strong. But so when we have patients are hitting a little bit older, that's one thing we're very cautious about. We want to make sure that to prevent dry mouth decay, because those decays are just so hard to remove because of the location.
Right.
And a lot of times, even though they're very small, since it's hard and difficult to remove, we end up having to be much more aggressive than we want to be.
Well, right. And that's probably going to cause, maybe a little more pain or bleeding. But, one thing I was
Yes.
looking here at, your notes is that gum disease, having bacteria could transfer into a gum disease, right?
Yes.
Okay.
Yeah, so bacteria causes dental decay, and another common disease in the mouth, which is called gum disease or periodontal disease. And due to the pandemic, a lot of patients have delayed their appointment. So lately we have been treating gum disease more than any other times because they have missed their usual appointments, their regular checkups. So it's tricky because gum disease is a silent disease, and sometimes you don't feel anything, but then all of a sudden one day it all starts to swell up, and you start to see signs of inflammation, which is bleeding, and that is when the gum disease has progressed into a very worse stage. So in summary, when they do come in, we find out that they have more bacteria build up around the gum and creating a periodontal pockets. So the pockets are the one that we are treating, because if you have pockets, you start to have more buildup. And the deeper the pockets, it's just harder for you to brush and floss, and therefore leading to attachment loss, bone loss, and the end result will be tooth loss.
Yeah.
So we can't stress enough the importance of having regular checkup. And when we find out that you do have gum disease, there are different types of treatments according to your stage. We are very excited. Dr. Lee and I have just bought a water laser. We've treated gum disease with water laser, which is I would say pain-free or almost no pain. And post-operative pain is very, very minimal, very cost-effective. So we're very exciting to introduce that to our patients. You want to add to that?
Yeah, so we've always had there's two types of laser: diode, which is usually mainly used for the gum, to treat gum disease, and usually the hygienists use it. We just bought a bigger, more powerful laser that we're able to do much more with it.
Okay.
But getting back to the diode laser, so when patients comes in and they have bacteria buildup, the laser does two things. The laser, we do a procedure called LBR, which is laser bacteria reduction. And what that does, prior to the cleaning or the deep cleaning, we do that. And what we do is we reduce the bacteria counts that is floating in the air, and also that patient, removing it from the body. Then, if we're doing procedures such as deep cleaning, afterwards we use a laser to remove the bad tissue. The diode laser is attracted to pigment. So the blood pigment, the bacteria, it's attracted, and you're able to remove it. And thus the patients have less bacteria than they came in with.
Okay.
The only negative is there's a 90 days. It usually takes after, so let's say you did LBR, which is laser bacteria reduction. It takes about 90 days for the bacteria to build up again. And so that's why we recommend patients that have some inflammation or gum problem to come more often, 90 days, so that we can control the disease. Gum disease is very much like diabetes. You can only control it. You're not going to ever get rid of it. Okay. So people that are able to control it, they're very happy because they usually do well.
Okay.
You know, now with the other bigger laser, the nice thing is there's less numbing. we can even do fillings, small fillings, without even numbing patients. And secondly, we are able to do much more aggressive procedures in much more gently, whatever you can call that.
Okay.
You're not doing a lot of the traditional way.
Okay.
So laser has come a long way, and we're very excited because we've been attending a lot of courses, and now we finally decide that it's a good investment, because what we want is to provide the care of today and use the modern technology so that we can minimize discomfort and maximize good results for our patients.
Well, that sounds great. I mean, how long has the laser been on the market?
Well, the laser has been around for many, many years. They have evolved, just like anything. Was very big, clunky, very limited use. But now you look at lasers being used in every aspect of medical field. You have dermatologists using it, hair transplant. So it's come a long way.
Okay.
And surprisingly, our diode laser, some of our patients come in for pain, and we're able to use the laser beam to reduce the inflammation and pain. So it's pretty exciting.
Well,
I like that. That's great. You don't have to stick the needle in there.
Yeah, no cutting. And like I said, post-op pain is very minimal. And look at the common procedures like frenectomy, a cold sore, or you can remove a little fibroma on your tongue, on your lips.
Oh.
And sometimes there's no shots. So
great.
even a baby who cannot
latch on to the mom
due to their attached frenulum, unusual, with the laser, you can just no anesthesia, and you just sniff it up without using a scissors to cut it.
Oh, wow. Oh, that sounds great.
Yeah.
Okay, well, good. That's excellent. Well, I can't wait till someone comes in and is able to use that laser. That's nice. I mean, have they started already or not yet?
Yes.
We have been doing.
Oh, okay.
Yes.
Oh, good.
Yes.
All right, great. And then just one last thing real quick before we wrap up. Oral cancer is something that we should be concerned about, especially, as you mentioned, when you get older and you just don't necessarily maybe pay that much attention to your mouth. So what would be some things that they should look for?
Well, usually you want to make sure that there's no sore that's getting bigger, or any swellings under the tongue, just any kind of a swelling that is getting worse, any pigmentation, or maybe any white patches in the mouth. Sometimes, and so I think it's just wise that sometimes we irritate our gum by brushing a little bit quick, and we bang it in our cheek or our palate, and we want to know, hey, is it, most of the time we wait a few days and it goes away, then it's great. But so we want patients to be aware of their mouth, and we want them to look inside their mouth so that they can see if they're seeing anything, and then let us know. So every time we examine a patient, either it's a new patient or recall, we take the time to go over, look through the whole mouth to make sure, and especially in areas that we normally patients don't look, which is, for example, under the tongue or on the side of the tongue. So we want to make sure the patients are being cautious, taking a lot of precaution, look at the mouth. And also when we examine them, we do another second check. And I think it's just great. This way we can prevent a disease or the cancer that is very preventable, and especially treatable if we're able to catch it at an early stage.
Okay.
It's very
that's excellent.
good.
Well, that's important when you come in, that you do a thorough check, because you just don't know how long it's been since they've been there. So thank you both so much. I really appreciate it. You guys have a fantastic week.
Thank you, Lisa, for having us. We'll see you next time again.
All right. and we'll be right back after this.